Welcome to the November 17th, 2021 meeting of the Albany County Legislature, Elder Care Committee. We have a few items on the agenda for tonight's meeting, so let's get started. Majority Council Kennedy, would you give the roll, please?
Sure, Mr. Chairman. Ms. McLaughlin is excused tonight. Mr. Ricard?
Present.
Beston?
Here.
Chapman? Camiso?
Here.
Oh, Chapman?
Present.
Okay.
Here.
Cunningham?
Here.
Jamalowitz?
Here.
Hurley?
Here.
And Whalen? 7 present, Mr. Chairman.
So we have a quorum, is that correct, Rebecca?
We do have a quorum, yes.
Thank you. All right, now on to previous business. First item on the agenda is we have to approve the previous minutes. Did everyone have the opportunity to read last month's meeting minutes?
I did, and so moved.
Ms. Cunningham made the motion. Do I have a second?
I'll second it. Second.
All those in favor?
Aye.
Opposed? Motion carries unanimously. Okay, now on to current business. Authorizing an agreement with the New York State Office for the Aged regarding the Medicare Improvement for Patients and Providers Act grant. Commissioner Rattano, would you like to speak on that?
Yes, thank you. So we're just asking you to accept the money, and it would be $18,474. MIPA supports our outreach efforts and assists eligible Medicare beneficiaries with programs and helps them with to lower their insurance costs. This portion of money also supports our high cap coordinator, Sandy Martin. It pays part of her salary.
Okay,
And it's 100% federally funded.
okay. Do any of the legislators
Motion to
have
move
a
it.
comment? Any
So
legislators have a
moved.
comment? Does somebody want to make a motion?
Motion
So moved.
by Camiso.
Okay.
Second.
Mr. Camiso
Joanne.
made the motion. Do I have a second?
Second.
Second.
Chapman.
Ms. Chapman was the second. Okay. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously. All right, the next item on the agenda is authorizing an agreement with LifePath regarding adult daycare services for seniors. Commissioner Rattano, would you like to speak on that too?
Yeah, that's the RFP that we sent out. We only had the one response from LifePath, and we awarded them $131,820. 90% of that money is federal money, and I think 10% we put in. They were the only ones who responded. We actually reissued the RFP because we had a suspicion that one of the other providers had missed it, and that seemed to be the case. They do this at a much lower level, so we probably will have to come back to you when we get that in. But that's it. We only have the one provider right now who does adult daycare.
Okay. Do any of the legislators have any comments on this?
Yeah, can I ask a question? This is a great program. Adult day services are so important. Just a question, can any county resident participate in these adult day services, or is it income dependent? How does that work?
Usually adult daycare comes through, our New York Connects line. So, a caseworker would have been involved. Anybody in the county. I wish, we had really more than two places, but really what's kind of stopped it has been COVID, because New York State didn't allow any social adult daycare. So you couldn't get the seniors, out to a program. So it's, it's kind of fallen back a little bit because people just can't do it because of the pandemic. So we were happy to get this. She does a great program, and we're happy to see it go, because we have seen programs fold.
Thank you. It's great that they started it up again.
Yes, it is.
Thank you, Joanne. Does anybody else have any comments on this? Does somebody want to make a motion?
Motion to move it, Frank Camiso.
Mr. Camiso
Second.
made the motion. Do I have a second?
Second, Joanne.
Ms. Cunningham seconds. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously. Okay, the next item on the agenda, and thank you.
Happy Thanksgiving, everybody.
Yeah, thank you, Ms. Rotano.
You too,
I appreciate all
Thank
all of your efforts.
Bye-bye.
Thank you.
Thank you. All right, the next item on the agenda is authorizing an agreement with DentServe Dental Services, PC, regarding dental services for residents at the Shaker Place Rehabilitation and Nursing Center. Mr. Slacky, would you like to speak on that?
Yes, thank you, and good evening, everyone. DentServe has been our dentist for numerous years, but either way, their contract expired at the end of this year, or will expire at the end of this year, so we had to do an RFP. They were the only respondent, and it was RFP number 2021-126. However, they continue to be the lower bidder and the only bidder, because very few people, really no one in the industry actually does this work right now, but DentServe. I guess that's why they've been there probably for 2 decades, way before I got there. However, what we were able to do, and that's why we have a 3-year agreement, normally this dollar amount would be double, but Optum, which represents probably 50% of our resident population, is now paying DentServe directly to the Optum members, and 50% of our residents living at the nursing home have Optum. So I was able to negotiate, because they were the low bidder with DentServe, to cut the bill in half, because it's a fixed amount. Half the people, they're going to be receiving the money from Optum, and we were able to save over this 3-year period $108,000. So I think this is a good deal for the nursing home, and the residents will continue the same exact services that they've been receiving for years.
Thank you, Mr. Slacky. Yeah, do any of the legislators have any comments on this matter?
I just have a question. It's Joanne.
Yes, go ahead,
So
Joanne.
Larry, just so I understand this, are dental services covered in their Medicaid rate or their Medicare rate? You mentioned Optum. Are they?
Dental
how does that work?
services, dental services is a mandate under the New York State Department of Health regulatory requirements. And therefore, we're required to provide those services. However, and by the way, we get a fixed amount in our reimbursement from Medicaid for those services. So if someone is a private pay, they would pay privately, but all other residents fall under that regulatory requirement, and we must provide those services. And they're reimbursed, but that reimbursement is a fixed amount.
Right.
And
No,
therefore we will be able to, receive that additional money as regular revenue.
Okay. No, understood. Thank you.
Yes.
Thank you, Joanne. Does anybody else have any further questions?
I make a motion.
Mr. Beston made a motion. Do I have a second?
Second.
Ms. Cunningham seconded it. All those in favor?
Aye.
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 Opposed? Motion carries unanimously. Thank you. Okay, the next item on the agenda is authorizing an agreement with Leading Age New York regarding advanced training initiative. Mr. Slacky, would you like to speak on that too?
Yes. This is in a contract with Leading Age New York, which also happens to be the association that we are members of. They're a not-for-profit association for nursing homes in the state of New York. I will go over in the next request that the nursing home received a grant from the New York State Department of Health to participate in their Advanced Training Initiative program. And part of that program mandates that we spend those dollars on continuing education to our staff in specific areas And the 4 areas that we chose are part of Leading Age New York programming, and the cost is a not to exceed amount of $50,000, but we will be receiving a total of $250,000 in this grant, which will be utilized for other items during the year as per the grant requirements. But the education will cost approximately over the next 12 months of around $50,000.
Thank you, Mr. Slacky. Do any of the legislators have any comments on this matter? Would someone like to make a motion on it?
I'll make a motion.
Mr. Beston made the motion. Do I have a second?
Second.
Second.
Mr. Purley seconding it. All those in favor?
Aye.
Aye. Aye.
Opposed? Motion carries unanimously. All right, the next item on the agenda is authorizing an agreement with the New York State Department of Health regarding the Advanced Training Initiative Program. Mr. Slacky, would you like to speak on this matter too?
Yes. So as mentioned, this is a grant that the nursing home received, and surprisingly enough, it's for staff retention at our nursing home. So apparently our statistical data was better than others, and we did qualify for this grant. That will be approximately $250,000. As I just mentioned, $50,000 will be spent on education, and the balance of the money, which is in one of the attachments, will be assigned to different expenditure lines within our budget as per the grant requirements for recruitment and retention. So as an example, if we do a benefit for the staff as a pay additional dollars for retention, or we're using Braun Media to recruit, all of those expenditures will now be covered under the balance of the $200,000 that we're receiving from the New York State Department of Health.
Okay. Thank you, Mr. Slacky. Do any of the legislators have any comments on this matter?
I just have a question.
Go ahead, Joanne.
So Larry, how much of this 250, so 50 goes for the leading age training, which I just looked at, good, sounds like
Right.
good training. So that leaves 200,000. How much of the 200,000 goes toward like the recruitment stuff that Braun Media does versus actual salary increases for rewarding retention?
Well, retention, which could include salary increases. In one of the attachments, you'll see line 1922, which is the budget line for retention stipend, which goes directly to the staff. Of the 250, 150,000 has been designated for that. And then training, conferences, and tuition is 100,000. 50 of that 100 is already going to Leading Age New York. And the balance of the 50, we will decide over the next 12 months how to utilize. Right now, we are using a culture change program within our nursing home called Heritage Consulting to help us retain staff as well as recruit, but primarily retain and try to fix some of the culture within our building. So we put $50,000, that 100,000, the balance of the 50 will go toward that program, which is in essence going directly to the staff and trying to meet their needs in the day-to-day operation on a cultural basis and you know, let's be happy at work basis. You know, what's bothering you and how can we fix that?
So just so I understand, you said 100 of it actually goes into their pockets as retention bonuses, like kind of thing?
If the ledge at some point in time agrees to a retention stipend, as an example, which actually is in our 2022 budget, by the way, that 150,000 of that 250 will go directly into the staff's pockets.
Okay, but the legislature, so that's in your budget, but it's essentially paid for by this New York State grant.
Correct. It wasn't when we originally did it, but it is now.
That's great. I'm glad to hear that. They deserve that, and I'm glad you're rewarding folks who are staying on staff with retention bonuses.
Yeah, and so are we. I mean, it's just a blessing that we were able to get this money and support what the legislature really already agreed to. And now we have a way of funding it and not taking it away from other programs.
Thank you.
Thank you, Ms. Cunningham.
Motion to
Ready?
move it?
Yeah, I was gonna say, you want to make the motion, Joanne?
Sure.
Okay, do I have a
Chapman
second?
seconds it. Chapman seconds it.
Okay, I got you, Norma.
Thank you.
I have a first, and a second, I have a second. All those in favor?
Aye.
Aye.
Opposed?
Aye.
Motion carries unanimously. All right, number 7, authorizing an agreement with Nurse Connection Staffing regarding supplemental nursing staff for the Shaker Place Rehabilitation and Nursing Center. Mr. Slacky, would you like to speak on that too?
Yes, this is, we have 2 nursing agencies that we utilize. Nurse Connection Staffing has proven to be the better staffing agency that we use. Their contract expires December 31st, 2021. And this is a 3-year renewal of that contract. And clearly it's an approximate amount of $150,000 per year. Of course, we're not sure what services we're going to need. If our recruitment and retention program work well, then we hope never to use them over time. But right now, their contract is expiring, and this is just a not to exceed amount of $450,000. And that has been budgeted for in our 2022 budget, 1/3 of this amount, because it's a 3-year agreement.
Okay. Thank you, Mr. Slacky. Do any of the legislators have any comments on this matter? Would someone like to make a motion?
I'll
Motion.
make a motion.
Ms.
I'll
Cunningham
second.
made the motion. Do I have a second?
Second by Whalen.
Second.
Ms. Wellen made the second. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously. All right, the final item on the agenda is authorizing an agreement with Leading Age New York Foundation of Long-Term Care regarding a coronavirus emergency support grant, amending the 2021 Department of Residential Healthcare. Mr. Slacky, would you like to speak on this too?
Yes, this is another grant that the nursing home qualified for through Leading Age New York. We will be receiving through their foundation, and it's called the Mother Cambrini Healthcare Foundation, $25,600. And the RLA that I also submitted shows that this dollars will be directly dedicated to recruitment and retention in the form of education to the staff. That includes any consulting or work that may be done. And that is the purpose of this grant for the development of frontline staff. So we hope to develop the frontline staff. Hopefully maybe CNAs could become LPNs. And this money will be utilized through that for under the recruitment. And it's not under recruitment and retention on our budget. It's under continuing education. So the money is going to go directly to that line with this approval, and then spent to develop frontline workers, hopefully to a higher category of where they are today. And maybe if you're a dishwasher, you could become a cook, maybe a supervisor, assistant cook, LPN to RN. That's what this money will be used for.
Okay. Thank you, Mr. Slacky. Do any of the legislators have any comments on this matter? Would someone like to make a motion?
I'll make a motion.
Mr. Beston made the motion. Do I have a second?
Second, it's Joanne.
Ms. Cunningham seconded it. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously. And Mr. Slacky, thank you. I appreciate everything you and your staff do, and enjoy your dinner too, by the way.
Oh, thank you. And thanks for all the approvals. I'll speak to you guys soon. Thanks
Thank you,
again.
sir.
Thank you.
Bye-bye
Thank you.
now.
That concludes our meeting for this evening. Do I have a motion for adjournment?
Oh, Mr. Ricard, would you note that I was in attendance, please, Jennifer Whalen? I missed the roll call.
Absolutely, Legislator Wellen.
Thank you.
So would somebody like to make a motion to adjourn this meeting?
Motion to adjourn, Frank.
Mr. Camiso made the motion. Do I have a second?
Second, Whalen.
Second.
Okay. All those in favor?
Aye.
Aye.
Aye.